Can I say something kind of shady about it? Whoopin' Stoopin' Fart Chart Machine.
Oh, that's a great name.
Is that a technical term?
Yeah. You record that?
Yes, I did.
They turn that, oh, I thought you had the red light. Oh, I thought that meant stop.
Oh, it's going. Okay,
Well,
so
So
Okay.
what we're gonna want you to do is speak to Brady here, and
okay.
then when you talk about Intermountain, say Intermountain Healthcare, not IHC.
right.
And,
Dad, did you get that?
You want me to say Intermountain Healthcare?
yeah,
Is that
Intermountain
IHC?
Health.
Okay.
Not IHC, if you can.
Okay.
All right. So,
It's a 3-letter word.
okay, so can we start with, let's have you introduce yourself and tell us when you first started working at.
My name is Elwood M. Harrison.
Okay, hold on one second. Elwood, if you would not swing
You
your
don't want
chair
me
around.
moving?
Yeah, because we're kind of
Oh,
framed in tight on
oh,
you, so
geez.
you're like really moving
Wow.
in the
Well,
picture.
I'll start over.
Yeah, try. Yeah.
My name is Elwood M. Harrison, and I was hired by Intermountain Healthcare on June the 21st, 1954, and as an employee there until in 1980. I can't remember the exact month in 1980. Okay, through the year of 1980.
So you
Okay.
worked at the Pioneer Memorial Hospital.
At the Dixie Pioneer Memorial Hospital.
Can you tell us what it was like to work there?
It was owned by the county. For me, it was a pleasure. There was only, when I first came here, there were only 3 physicians on the staff that actively used the hospital. There were Dr. Wilfred Reichman, Dr. A.W. McGregor, and Dr. Conrad McGregor that were the physicians when I first came here.
Great. So you did
Okay, hold on. Go ahead and ask your question, Brady, but I gotta.
you did lab and X-ray work.
Yes, yes. I
Oh,
was.
one second, please. You just kind of rocked a little. And
Dad, you
came
can't
out of
move.
focus. No, he's fine. He's fine. I'm set.
Go ahead.
I came here. I was as a lab tech, and I pursued that and took over the department and did that until about 1961. I was the sole laboratory tech in the hospital.
And you also did X-rays, right?
Huh?
Did you do
Yes,
X-rays?
and then there was an X-ray tech in town that worked for the McGregor Clinic, and he, between the two of us, we got the X-ray work done.
Can you tell us a
Lorraine
little-
MacArthur.
Tell us a little bit about changes that you saw in radiology and imaging.
Pardon?
Changes you saw in radiology and imaging over the years that you worked in doing.
Well, it was mostly diagnostic procedures. We did as a result of accidents and trauma, the US 91 ran through the city and out over into down into Nevada. And it was a very busy highway, and there was a lot of trauma, auto accidents. The total population at St. George that time, I think, was around 5,000 people, which is not a lot for the size of the county, but that was we mostly all the family practice patients. Most of everything else was either transferred or went to other facilities.
Okay. So can you talk about how the financial situation of
Well,
Pioneer
when I first came here, the financial situation was desperate. maybe that's the wrong word, but it had up to the time I got there, there'd been 3 or 4 lab techs and the same number of administrators, and help was always a difficult problem. But the ones that were here were wonderful and practiced their art. I was very proud of them. I was and felt very comfortable working with the people that were there. In fact, I had a lot of love and respect for them.
Great. So, was it hard for the hospital to make enough money to stay in business?
Pardon, sir?
Did the hospital have a hard time making enough money back
Yes,
then?
we were constantly in trouble. In fact, this is maybe not the truth, but I'm going to say it, but because I was told it once that if you need money, don't come up here for it. Bring your resignation with you. So things were very difficult financially, and they continued to be up until the middle 60s, but by then we had a staff of about 50% specialty and 50% family practice.
Great. So, can you talk about what it took to build the new 400 East Hospital?
Pardon?
When it was time to build the new 400 East Hospital, can
Yes.
you talk a little bit about that? Why you needed to move
Well,
out of the Pioneer building?
We were under discipline from the state, physically for the building. We were always not in compliance with the state code. So every 6 months we'd get a visit, and they'd tell us you need to do something about it. And so finally we'd make an application, and they'd give us the hospital was 30 beds, and they would give us a 10% increase in bed size. So we really never were going to go anywhere. So finally, through the county commission and stuff, we had a meeting with the governor of the state of Utah. And we met with them and the health department, which had jurisdiction over the hospital at the time, and told them of the problem, that it was a two-edged sword and that we needed to do something about it, and we would appreciate some help and cooperation from the state. And this, by the way, was all done through the Washington County Commission. And that we did. We had a meeting with the governor, and we were advised at that time and helped to acquire. We received an invitation to a meeting in Denver, Colorado, where they met with the regional people from the federal government, and we went and had a meeting with those people. And after they advised that we get a study done, and the county acquired that with Arthur Young and Company, and the completion of that and the review of it, it was decided that 3 beds was not going to fit the need for the county. And besides that, what county was starting to have some growth in it. And so we made a visit to Denver, and we were granted 70 beds, is my best memory of beds, with a 100-bed core for the hospital. And when that was that was awarded to the hospital, which was kind of an exception to the usual rules on awarding. They moved the requirements off of just number of beds was to actual procedures and physician facilities, and that's where we went. The county issued a bond issue. There was a fund drive that was done by the local people and supported, should be noted, very generously by the local people. And we proceeded, the bids were let and acquired an architect, and it was decided where to build it by the county. And construction was started. I cannot remember the exact date, but it was in early 1970, 71, when the construction started on the hospital. And to my knowledge, there was 4 grants written for with the help and the assistance of the state. And the funds were raised before we were allowed to start for the bid, what the estimate was of the hospital. At the completion of the hospital, it came in under budget, and with what I consider it, from my behalf, is they did a wonderful job. It ran, it worked, and the county at the time was having a considerable amount of growth by then. The Bloomington subdivision was in effect, and we were not lacking for business at the completion of the hospital. So from that, and we had applications from additional physicians. We made plans for a nuclear medicine department and physical therapy and other additions to the hospital, and those were applied for at the time of the opening of the hospital. Subsequent to that, the county made a decision that the hospital needs were going to exceed what was available county-wise, and the decision was to contact Intermountain Healthcare, which was done. And the contracts and discussions and with the county, and from where they're coming from, and it was decided to sell the hospital to Intermountain Healthcare at that time. And that happened during the fall month of 1976. The hospital itself opened for business on January the 1st of 1976. That's about it.
Intermountain Healthcare.
Pardon?
It was sold to Intermountain Healthcare right after it opened. Is that correct? Or pretty soon afterwards?
The what?
When was the hospital sold to Intermountain Healthcare after it opened?
I'm sorry, I can't hear you, sir.
The hospital was sold to Intermountain Healthcare after it opened.
Yes,
How
it was.
long was it?
There was an interim when there was a contract until the details of the purchase of the hospital by Intermountain Healthcare from Washington County was all done through the year of 1976.
Okay.
And that, as a result, is what's there. It's a magnificent, I heard it one called by someone who knows what they're saying, it is the jewel of this valley, is Intermountain Healthcare. And I am very proud to have been a part of it. Thank you. Thank you very much.
Thank you.
Thank you.
Can you remember any great stories over your years of working at the hospital? Like maybe you could tell us that story about John Wayne.
Well, we had, back in those days, there was quite a few movie companies moved into here. And one of those was, we had, was John Wayne was in, what was the name of it? What was the name of that?
It was Genghis Khan.
Genghis Khan, that's right. And it was filmed out here on the mesa between here and Pine Valley Mountain and up in
Start out
between.
again, like with the John Wayne was here for that.
And he was the star of the movie. And during that period, the star of the Mexican movies got in a horse accident, and he had to be shipped. They flew him out of here to a hospital in California, and in about 4 or 5 days he was in the hospital, Mr. John Wayne made annual and regular visits to the hospital, and he'd come to the hospital in his attire, and we felt pretty uppity up because he did not look like John Wayne. He looked like the Genghis Khan, and you know he claimed he was the ruler of the earth, and it was the patients and the staff got quite a large amount of enjoyment out of his visits and at the hospital.
Great.
So,
Can you remember any other great stories?
well,
A drink or anything?
we had well, anything very spectacular. We had a sonic boom one day that knocked all of the windows out on the west side of the building, which was created by the supersonic aircraft that were flying out of Nevada. Up here at the time, we were a test site, a bomb site this was during the Vietnam War. They knocked all the windows out, all the windows on the west side, which was a full block, but it was all glass, and so they had to replace the glass. But that was quite an uneventful event, and but it was at all this time. It should be noted that we bore the brunt of added physicians, added patient days. We were a very, very busy little hospital. We had, like I said, 3 or 4, 5 or 6 of the main specialties of the physicians covering it, and we were constantly over using the halls for purposes under which they were meant to be. And the people and the staff responded. I think they did a fantastic job. The greatest people on the earth. I can say nothing but the praise for those good people. And I mean that. They were great. Wonderful people. My joy. They were the joy of my life.
So I heard I heard the old Pioneer Hospital got pretty hot. Can
Oh,
you talk a little bit
hot.
about that?
Like I said, they were all glass. The windows were all glass And in the afternoons, the any work that was done in the hospital on the west side of the building in the summer months became a steamer, a cooker, and we were not cooled by refrigeration. That was a word that was used but never used in the hospital. And during the process, right after the purchase, one of the events we did do, the hospital, through its efforts and help, we were able to get refrigeration in the emergency room, the surgery, the labor rooms, and the delivery rooms, and made things bearable. It was almost unbearable in a building with all that glass without something done. Things were very difficult physical conditions to work under, but they did, and we did a good job. I'm very proud of what they did. It took a lot of human effort to make it work, and we made it work. It proves it can be done.
Yeah.
Thank you.
One other thing, back in the early days, the hearses also served as the ambulances.
Oh, yes. We had 2 funeral homes, and I'll not advertise them, but there were 2 of them. And the ambulances were used for purposes other than ambulances. So, anyway, and they only had funeral hearses too, but they were operated by the local funeral homes. And all I can say for them is they did, under the circumstances, operated and did a good job. They had a zone of operation from the Black Ridge south to the Nevada border and north to the Black Ridge. And that was their zone of operation, and to the county line on the up to Enterprise and to Springdale on the east. And they did provide ambulance service. It was operated through the Highway Patrol and the radio system of the State Highway Patrol for whenever accidents occurred within the county. And maybe I'm not a very good judge of it, other than the fact we received the product, but they worked at it. They did a good job. As good a job as could be expected under those circumstances.
So when you had to send people out, we heard that at some point you started using SkyWest airplanes.
Yes.
For a while. Can you tell us?
They had a 2-seater up front, and they'd take one of the seats out on one of the pilot seats. I think it was what they call the right-hand seat, and slide a stretcher into the airplane, and volunteer pilots and would fly and nursing volunteer. Most of them were volunteer nursing staff, and physicians rode with the patients to hospitals, mostly in Las Vegas and Salt Lake. And that included clear to the day that the hospital opened. And the time I went there, that was the service of those ambulances. And that's about all I can say about that, other than there was a lot of effort put into that. And
Now, back in the day when there was all this radiation testing, do you have any stories related to that?
well, there wasn't a lot said about it, I'll be quite frank. The bombs were being set off in the early morning hours, mostly from the test site, and people within the community and county would go up here on Utah Hill and down, and we did down at the hospital. Hospital personnel knew when the tests, they published it, when those tests were going to go off. And you could go out and stand there and watch. The whole sky would light up and you could feel it and hear it. The effects of that atomic blast. And later in the day, you could see the cloud of dirt and dust going past on the south and north of the town on its way northeast out of St. George. The president of the college, then Mr. Arthur Bruin, as I turned later, was considered to be one of the victims of that fallout. So yes, there was people, patients, and people paid the price of the atomic bomb blasting it and testing it in Nevada. And that went on until they called it quits. They were either above ground or some of them were underground. And of course, we were never involved in it any physically otherwise use. But we did know when they were setting us off. They notified us. I mean, that the government would notify us of the tests. And people, sometimes they stopped the highway traffic out here on Utah Hill during those blasts and during a duration of, and sometimes the cars were brought into town and hosed down to remove the fallout that occurred during the post-testing of the bombs. So, yes, it did affect the community. It surely did. And we were later designated a post, I don't know, bomb blast area. They have a name for it. What is it now called? Huh? Downwinders. Yeah, they got a bill through Congress to support the effects of, under certain conditions, the government supported the downwinders for, excuse me, I had to do that. But that's, in fact, I think that's still in effect. Yes. To this day, there is still the effects of that, on the downwinders. The people can prove that their presence and where they were at the time those blasts were used. So, very much so.
We got a chance to talk to the mayor yesterday, and he was quarterback, and he said he had quite a few visits with you. Do you have any funny stories?
He was constantly breaking pieces, like they call them bones. And he would come visit the hospital to have plaster of Paris used for his casts and stuff. The mayor, Brother MacArthur, was a visitor, yes, in our hospital. Very proud of him. He's a great mayor. I knew him personally. I helped him with the Little League baseball. So I got to know Brother MacArthur quite well during his tenure when I was still at the hospital and he was mayor. And he was a neighbor, and in fact the matter is, go one step further, he was my bishop. So I knew Brother MacArthur very well. Thank you.
Can you?
There's other things. I'd think there's other names that should be mentioned in I think a lot of credit. Mr. Webb, the county commissioners, and I'm not going to name Murray, and the county commissioners deserve a great vote of thanks that could see forward enough ahead and use their positions to get what we got in this valley. Were it not for them, that facility would not be there. I don't think it would there be anything that even resembled it to this day without the county commission, and there was support from them, all of them. That's the reason I don't know whether names should be used, but they was without their support this never would have gone nowhere. But they did. They took the ball, they ran with it, and they got it done with a lot of extra effort. And the people of this county owe a debt to those people who did do what they did do, and they accomplished it. There was a great need, true, but they met it and provided us a service here that this place is valued as a health center in the state of Utah. It is valued as a health center, and I'm very proud to be a part of it. And I want to thank everybody for the privilege which was mine.
Can you mention a couple of those commissioners? One was Murray Webb.
Well, Mr. Truman Bowler was the chairman of the board. Murray Webb and Floyd Entz was there part of the time, and Murray Webb were they were designatees of the county commission over the health care in the county. That was my understanding of their positions in the county commission. That they have assignments for certain areas, and Mr. Floyd Entz, Murray Webb, Truman Bowler was the chairman of that commission all the time through the election. That was chairman of that commission, and that spearheaded that effort. And people in the community, the mayor, all the civic clubs. It was a whole county effort to get what we got. And as far as I can remember, there was great support for it, because things like that don't move easily. Very expensive. But I think it has been rewarded and rewarded and rewarded numerous times for their efforts. And they should be proud of it. And they are proud of it. It is the health center of southern Utah, as far as I know. It is. It is the leader of the healthcare business in southern Utah. So, without any question, it is. And I don't think there's anybody around here would be obliged to challenge me on that. Thank you.
All right.
Hey, thank you
I think
so
that's
much.
good.
You gave us some amazing information that